Welcome to another episode of the Chronic Comeback Podcast. Today, I am really excited to have on the show Perry Nickelston. Sorry about that. So Perry is a chiropractic physician, creator of the Body Aquarium, and founder of Stop Chasing Pain. He is an expert in movement assessment and diagnosis, certified and trained as a functional movement specialist and selective functional movement assessment specialist. After suffering a severe back injury himself and recovering with laser therapy, he decided to dedicate himself to offering this amazing treatment modality to others. He's also the creator of Core 4 Recovery and Regeneration Program, a self-treatment program whose sole purpose is to empower people to take back control of their life from chronic pain. So there's a lot to get into there. Thank you so much for coming on. Apologies for screwing up the pronunciation of your name. How are you?
Oh, no worries, my friend. Thank you. I'm grateful and honored and really excited to be on your show today.
Awesome. So what I want to do is, really go back into your story, really, because I know you now, your life and your profession is dedicated to helping others. Before, you really kind of started to get into what you're doing now, what was life like then? And could you take us through the story, your own chronic pain story?
Yeah, that's a great question. Well, I think it's like most people when you get into healthcare or find your life purpose, it's usually through pain and suffering or catastrophe or hitting rock bottom, social rock bottom, physical rock bottom or illness. And it was for me, it was a slow transition into that. So I started my journey into healthcare doing chiropractic because that profession helped me walk again after my lower back was decimated from doing too many things that I shouldn't be doing and not taking a break when I was into active bodybuilding. And a chiropractor pretty much saved my life, honestly. And I thought, well, that's kind of a cool thing to do. So I did that. And it was more along the musculoskeletal route, dealing with back pain a lot and, knee pain, shoulder pain, basically where everybody would point and say it hurts here. And it worked great for a while, but I was always feeling that there was something missing in that model. And I kind of got frustrated because I felt like I was just doing the same thing over and over and stuff kept coming back. And I was always questioning, well, I know why stuff may happen to people when they get injured because that's life. But I'm like, why does it keep coming back? What's up with that? And then that's chronic pain. And then that can cross over and be with chronic disease at the same time, which is getting worse. And it just so happens that later on in life, probably 7-8 years ago by now, I got my own illness, chronic disease, autoimmune type issue. And I never really got a label for what it was. It wasn't, okay, you have this or that. My whole immune system and body just decided to check out and go a little bit haywire. And so I was starting to get a lot of infections and my whole body just began to shut down, honestly. And it got so bad that I had to close my practice. I had to stop seeing clients. I was basically sleeping 20 hours a day and still feeling tired. And medical approach was not helping me. If anything, it made me worse. They weren't doing it on purpose, but they only have one lens to look through. If they can't throw you a pill or cut it out, I don't know what else to do for you, or worse, they say, we can't find anything on your tests. And I'm like, well, why am I feel like I want to die? You're missing something. And I knew that even the stuff that I'd learned over the years in relationship to more of a holistic approach to chiropractic and movement, it wasn't enough either. That wasn't an answer. I had to change my lens completely. And when you hit rock bottom, you got two choices. You're either going to have to change the way you think or you got to give it up. And that wasn't an option for me. And then that's how I came across what I teach now and my thinking process now, and basically rescuing myself from the abyss. And I'm going to preface it to say this right from the outset. I'm not really so much of like, you have to do this particular technique or you have to do this particular modality, and that's the one that's going to get you better, because it might not be. What might help you won't do squat for somebody else. So it's not the technique. It's the concept that you need to pay attention to. Like, you have to understand what you're trying to accomplish with the body and why what's going on is what's going on. And then your techniques are tailored around your concept of recovering from that. Right? So that's one of the things that I'm teaching people right now, is to understand through my lens how I see things, what's going on, and then give you that step-by-step process in order to recover from that, which we'll get into a lot later, I'm sure, of what those concepts and what those steps are.
Mm. So with your own story, you said you kind of learned, the techniques and, the concepts that you know now that helped you. Where did you get that from? Like, where, was it from loads of different sources and then you collectively, came to a thesis essentially, or?
Yeah, great question. It's a lot of different things. So I've studied from many different disciplines and many different people, because I learned we're all trying to get to the same destination. We're just taking different roads to get there, or we're using different language for that. So the biggest thing was going more back to looking at Eastern medicine approaches, Ayurvedic medicine approaches, and old school classic osteopathic medicine approaches from the late 1800s, early 1900s, not the osteopathic medicine of today, because that's all along the lines of the medical approach. And it was looking at the body holistically, of course, but of all the different systems of the body. So the one that hit home to me is that, as a chiropractor, I was mostly looking at the musculoskeletal systems, muscle, fascia, which is connective tissue, joints, ligaments. I mean, I could put any bone from point A to point B in my sleep. That's not hard to do, and all the different techniques to address those. But that's one system. You've got your nervous system, of course, and then you've got your circulatory system, and then your immune system. So there's a lot of different systems that are working in there. And I really wasn't paying attention to any of those. I was just going after the musculoskeletal one, and probably the nervous system too. You can't not go after that because everything affects the nervous system. But I really wasn't paying a lot of attention to the immune system and the circulatory system, blood flow in and blood flow out. And that premise is really big in Eastern medicine and osteopathic medicine. And I had to think to myself, okay, well, I learned from somebody, his name is Jerry Tennant, and he's a medical physician who recovered from illness. And he said to himself, a statement that really stuck with me: chronic disease only occurs when you lose the ability to make new cells that work. Because if you could make new cells that work, it wouldn't be chronic. You follow? Because you got injured and then you recovered. So it's not just about healing ones that get damaged. That's part of it. But you got to be able to make new ones. And then all you have to do is sit down and ask yourself, okay, well, what the hell do you need to make a new cell that works? I mean, there's got to be a basic formula. And if you break it down to two things, it's really simple. Cells need nutrients. That's supply chain of stuff to get to it, right? So it needs nutrients in, and then when cells use those nutrients, because they are living beings, well, they create waste, right? And then you got to get waste out. Two big things: nutrients in, waste out. If you have either one of those not working optimally, you're not going to be able to make new cells that work because you don't have the ability to. The environment's not there. If they stop working with nutrients in and waste out completely, you're dead, right? So that's where life ends. But a lot of people with chronic disease, they feel like they're slowly dying, right? So you got enough to hang on by a thread, but then you have to look at those processes. What are the systems that are really big in relationship to that, right? And then what I found is that in Western medicine, we don't look at how systems work together. We break them apart and we isolate them, and we have specialists for one system and this system. I got a neuro guy. I got an immune person. I got a gastrointestinal person. Okay? And they don't talk to each other. I'm like, well, you know what? In your body, they always talk to each other. So one of the central premises of my work is that no system in the body ever works alone, ever. If you have an issue with one, you can have an issue with all of them, and nobody looks at the one that's not complaining the most. You understand?
Yeah.
And they never get injured alone. You can't just injure one. Like people always say, hey, doc, when I injure my shoulder, you touch my shoulder, what system are you affecting? Yes is my answer. All of them. You can't separate them. And they don't heal alone. You can't just treat one system without affecting the other one. And there's no isolation either. You can't just work a painful shoulder and get a painful shoulder better. You can, but it's probably not going to last that long. You have to look at the whole picture of that. So to answer your question, two of the biggest things is one, going back to basics and fundamentals of what do cells need in order to make new ones and why can't they? And then looking at how all of these systems interact with each other and not just paying attention to the one that's screaming the loudest, because that's what everybody else is doing and you're not getting any better. Does that make sense?
It does. It does. So we've had a few people on the show when we've talked about chronic pain who recovered through John Sarno's work.
Oh, great. Yeah.
Yeah. Okay. I just
TMS.
Yeah. So because there's from that school of thought, and I've read his book, but it was a while ago. But I guess for those who are listening, I'll give you kind of like my understanding of it is that, when you have these chronic injuries, there is a belief deep down that you are broken. And therefore, by doing stuff like massage and physio and stuff like that, it builds into this mindset of you're trying to fix something, and therefore exacerbates this negative cycle that you're broken. And the minute you actually realize that actually nothing's wrong, you're not broken, you kind of start to break that cycle, and therefore you're not in this fight or flight mode, and you can begin to heal. Is that right? And if so, does it overlap with your way of thinking? Do you incorporate that to what you do?
Yeah, I think you said it very well, and I agree with it 100%. Right.
Okay.
People may have heard this before, and it's true. You can't separate mind and body. They always get. That's a man-made bunch of crap anyway, right? So there's just an energy. I call it energy, right? And then we name the energy just in different parts, but it's all energy. So TMS stands for tension myoneural syndrome or tension myositis syndrome. I like myoneural better. So let's break it down. Tension means tension. Tension from what? Well, it could be postural tension, muscular tension, right? Also psychological tension, social tension. And excess tension is tightness, right? And tight tissue doesn't accept blood flow well. I mean, that's how people out. Make a fist and make it tight and hold it that way for about an hour and let me know how you feel. You're not going to be able to feel your fingers. You're going to have pain, tingling, and numbness. That's exactly what happens in your body when it can't get blood flow. That's nutrients in, my friend. And it turns white. So it doesn't have to be a big tension. It could be tension that's settled in for you over 15 years. And then for 15 years are great. Then all of a sudden the next day you're not, because your body has lost the capability to adapt to its environment. It's hit rock bottom. And then it sends you pain, not to punish you, but to tell you, you need to change something quick, fast, and in a hurry. I don't know what it is, but it better be different than what you're doing, because what you're doing ain't working. That's all it is. So pain is a request from your body for change. And the more you don't listen to it, the more it screams and the more it hurts. So big thing to remember, decreased blood flow to muscles and nerves, myoneural. So muscles hurt when they can't get blood flow, and nerves really don't like it when they don't get blood flow. Why? Because that's oxygen. So you basically have cells that are slowly starting to suffocate all the time. And I always tell people, imagine how you feel when you can't breathe. That's my joke, because your cells are you. That's what they feel all day long, right? And so that increases the stress response. That increases the fight or flight response. So that decreased blood flow means decreased nutrients and decreased oxygen. And all day long, you're in a state of slowly dying, and your stress level increases. And that excess stress is what starts to break the body down. They're finding that one of the number one causes for chronic disease is chronic, incessant, never-ending stress. Of emotional stress is a big one, right? So they talk a lot about, anger and rage is pretty big for one in Sarno's world. that you have to come to terms with that. Interestingly enough, in Eastern medicine, the liver is the one that harnesses anger and rage. So if you got a liver problem, you're going to be sick, and you can have any diagnosis you want from that. So in my world, everybody has a liver issue. They just don't know it yet, because an Eastern approach is the organs hold emotions with it. All right. So people feel like they're broken, but it's also the body reacts that way when it feels like it's under a threat to the system, because that's what fight or flight response is. That's the sympathetic nervous system kicks in all the time, and it can't let you rest because it feels like you're going to die. And it happens from a subconscious level. And that's what I really want people to understand is it's not so much the emotional one. That's a big, big piece of it, because the emotion also changes the tension in the body, right? Like you can think of a situation when life was difficult or someone was mean to you, or you got triggered on social media, and your whole physiology changes in a split second, right? You have tension. But if you flip that switch and you think of something different, or somebody distracts your attention away from that through a different story, then your body changes completely in the next second. That's a lot of change to the system, right? But if you have underlying cells in your body that are not able to get good blood flow and nutrients in and waste out, that's a subconscious threat to the system happening all day long that you're unaware of. That's why I concentrate on blood flow and lymph flow so much, because you need both worlds.
Do you think that also what's ended up happening to me is that through having all this stuff I've got going on and like chronic injuries, I was someone who's so active, and then because I was injured, I kind of just gave up and just stopped doing activity altogether. And therefore, whenever I tried anything normal, I'd be so scared of getting injured, I'd just get injured again. And then because of that, my body had I was weaker and everything like that. So do you think one of the worst things, and I know I'm focusing on chronic pain here, it's just, I feel like, I want to ask about it. Do you feel like it's that people getting less active and kind of accepting that this is how it is, that could just make things a hell of a lot worse and things can go on for a lot longer?
Yeah, absolutely. It can go both ways. People can do too much, which keeps them from getting well. So it's over treatment, over therapy, which actually happens more than you think.
Yeah.
Because you're pushing too much on a system that doesn't have the capacity to do anything with it.
Yeah.
And then the other one is where you just run the other direction, and then you don't do anything because you get scared. Yeah. Because pain is like that. Pain is protective. It's supposed to tell you need to watch out for what you're doing, and you need to seek some type of safety somewhere. But you can fall into the quicksand of pain where it immobilizes you and you're scared to do anything, right? And once you study pain, you realize that pain, the level of pain, has nothing whatsoever to do with the amount of physiological damage to tissues. None whatsoever. What I mean by that is that you can have a paper cut and it can hurt you like you would never believe. And then you get people that get shot, or they have something, an arm ripped off, and they don't feel anything. Right. So there's no correlation. And they see that in tests too, where they do MRIs or studies, and then they show people, well, you've got this, and they're like, well, thanks for letting me know. I don't feel anything. Right. And then you've got somebody else that all the tests show nothing, and then they can't move. Right. And that's a slippery slope, because we want something to blame all the time. And when you see it on a test, that's your culprit. I'm like, well, who the hell told you that? Maybe it is, maybe it's not, but you're allowed to have more than one problem too. So a lot of times we just go after that one thing, and then you become whatever your diagnosis is. I'm the guy with the disc herniation. I'm the guy with fibromyalgia. And then you get on Google and you read everything about that. And the next thing you know, you got every symptom that's listed. So it's a self-fulfilling prophecy. But you need to understand that pain is 100% subjective and all perception. There's no objectivity to it at all, which means that it is all in your head. It sends signals up to the brain from the tissues, but your perception of it makes a difference in how much it hurts. That's why no two people experience a stimulation, a sensation, the same way at all. And that's also why you can't treat two people the same when any diagnosis, because you can come to a diagnosis completely different way than somebody else did. And you means you can't treat them the same way, not just pain, but fibromyalgia. You never treat fibromyalgia people the same way because they're different people. You have to go by their life story. And that's important. Life story is called your history. And your life story is what you tell yourself about your life, because that makes a difference on how you perceive pain. So the brain is the master controller of that. And that's important to know. But in my world, I'm going to go back to you and tell you the same thing. Well, your brain may be the master controller of pain, but I'm like, does your brain also need nutrients in and waste out? And your answer better be yes. And I'm going to go back to the same thing. Blood flow in, blood flow out, and lymph flow. The capacity for your body to have an environment where it can function at its optimum so the brain can do what it's designed to do 100%. Because I'm going to die on my sword, brother, and tell everybody that if you have an issue with the delivery systems of nutrients in and waste out, I don't care what you do. You're always going to struggle to get well because you don't have the fundamental building blocks to make it happen, even though the body's trying to make it happen. And that's what stop chasing pain means, because it doesn't mean that that issue is just where the pain is. It can be somewhere else that you don't know about, especially the brain, because the pain in your knee is also in the brain at the same time. So that's why I don't isolate any injury when I treat it. I'll start there because you expect me to. Like if your knee hurts, you're going to point to it and you're going to say, my knee hurts. I'm like, okay, well, let's start there because you want me to, because if I started on your elbow, you're going to be like, this guy's out of his mind. He's not even listening to what I'm telling him. So I'm doing that to also have empathy for you, that I know where it is and I understand where it hurts. And then we branch out from there by listening to your story and doing a full body, whole body assessment, not just where it hurts. Does that make sense?
It does. It does. I want to go into what you've been saying about nutrients in and waste out. So when you say nutrients in, are you talking about simply the diet you're on, or are you thinking about in a different way?
Well, I mean, you need a lot of nutrients, right? You need minerals. And most people don't have enough minerals because stress depletes minerals. And the food that we eat today in the world, particularly in the West, it's not real food. I mean, it's fake food, or it's food that's grown in non-nutrient rich soil, or it's sprayed with all the chemicals called glyphosate and stuff like that. I mean, you're lucky you're eating anything. So you're not even getting the minerals that your body needs in order to make enzymes. And if you don't make enzymes, you're not going to be able to get energy to a cell through the Krebs cycle. So here's the thing about nature and physiology. One thing needs another thing that needs another thing to work. And a lot of people are chasing downstream problems and they're missing the 15 steps prior that you need to look at. In my world is this: if you don't have minerals, you're not getting better, period. So you need to look at minerals going in. So nutrition is a big one. And that one is basically straightforward: is stop eating crap and eat better. Just do that. And you're already off to a good start, right? Because everybody has a different nutrient plan and different diet plan. What works for you would make me worse. You have to go by the individual. But you need nutrients like macro and micronutrients, right? Protein, carbohydrates, fats, and to be able to make amino acids from protein, right? But you also need water, because if you don't drink enough water, you're not getting better either. I don't care what you do. But I'm going to have to hold on to that thought, because just because you drink water and just because you eat nutrients doesn't mean you're absorbing them. Those are two different things. Ingesting is not the same as absorption. Please remember that. Okay. And then you need oxygen, and you get that through breathing, right? And that's why breathing is important, because you can live weeks without food, days without water, minutes without oxygen. So which one do you think is more important to your stress response and your TMS? Which one is more important? Breathing.
Yeah.
Right. So that's why diaphragm breathing is a big one, and making sure that you don't overbreathe, you don't hyperventilate. It's because people overbreathe, and that makes a difference on the carbon dioxide and oxygen ratio in the body. If you don't breathe the right way, you're not getting better either. And if you don't sleep, nothing I do will ever work. So I ask people about those 4 big boxes. And if you say no to those 4 big boxes, I don't care what kind of fancy rehab program you give me. It's not doing squat in the long run. You're going to tread water or you're going to sink.
Yeah.
Because you're not giving your body what it needs to actually do its job. And it's saying, dude, all you got to do is just give me these things and I'm going to run with it. I'll take the baton and I'll cross the finish line. Just be there for me, will you? So nutrients in, right? Those are some big ones, but it's really important. I'm on a roll now. So you got to hold on because now I'm going. So when you ingest something, your body has to break it down. And the first place it breaks things down is in the stomach. And the primary thing you need to do there is stomach acid, right? Stomach acid breaks down food. It's also your first line of your immune system to kill stuff that gets in your mouth that's not supposed to be there, like a parasite, like a bacteria, like a toxin, like a virus, anything that you swallow. What happens if you're under a lot of stress in life? Sympathetic dominance. When you're under sympathetic dominance, your body automatically decreases stomach acid production. So when you're under stress for a long time, you automatically don't have enough stomach acid to break things that's sticking into it to break down. So you're not even breaking down the food to make the nutrients. So step 1, do you have enough stomach acid? Yes or no? If I don't check that box, nothing I do downstream is going to work well. Does that make sense? So let's say you can break it down. Then you have to be able to absorb it. It's got to go into the cell. In order to go into the cell, it's got to go from this thing called your bloodstream. That's the delivery system. So the nutrients are in the bloodstream, but it has to get across into the cell. In order to get into the cell, it has to cross this water-filled, fluid-filled medium that's called your interstitial fluid. That's basically the fluid that surrounds the cells of your body because you're mostly water. What if you're dehydrated? You're already behind the 8 ball because you're dehydrated. So if that fluid is you're dehydrated or you're overly toxic and you have a poorly functioning lymphatic system, we'll get into that later, then even though the nutrients are there, they can't cross to get into the cell. So the nutrients are there, but they can't get there. Then let's say by some miracle, it gets in there because it is a miracle. Then your body has to metabolize it. Metabolize it means use it. And that's the energy cycle. That's primarily the Krebs cycle where you make ATP, which is energy so you don't die. And if you have ATP, you feel great. You have energy. You're alive. If you don't make enough of that, you feel tired, fatigued, lethargic, and sick all the time. Right? It's like a battery that's run dead that you need to supercharge. And if you don't have enough minerals, guess what? You're not going to metabolize. Now, let's say by some miracle you metabolize. Well, when you metabolize, guess what you create? Energy. When you make energy, what else do you make? Waste. And the waste has to go right back out. This is really important. The waste has to go right back out into the environment around the cell. So the cell takes in, the cell poops, and it goes into that environment around the cell. And then it has to get out. And then which way does it get out? Well, that's your detoxification system. That's the veins of the body. That's going to be the liver of the liver, the kidneys, pee, poop, sweat, and lymph. Right? So if you have a problem with excess tension, decreased blood flow, the veins don't move waste out. Excess tension decreases lymph flow. You get stagnated. So basically, you're living in your own crap around your cells. And I don't know about you, but that doesn't feel too good. That's like going to the bathroom in your house and your toilet, and you can't flush the toilet. It's not going to work out very well, right? So then you're living in your own waste. And when you have all that waste, your body thinks to itself, holy cow, there's stuff here that's not supposed to be here. We better fight it. We better kill it. Then the immune system says, guess what, man, that's my job. I got you. So then it creates one thing that everybody gets that causes all the illnesses that you have. I don't care what you call it. It's the same cause, inflammation. Then everybody gets inflammation. Now, inflammation is not bad. You need inflammation because that's how you heal and recover so you don't die. It's only a problem when you're always in inflammation. You understand?
Yeah.
So you have to understand that process, man. If you don't understand that fundamental process and you go at it the wrong way, you're going to do stuff that can be helpful, but you're not going to get better because one, you may be too much to a system that's overloading it, or you're doing things in the wrong order. And what do I mean by that? This is it right here. Everybody's focusing on the nutrient side. Got to breathe. Right? Got to eat right. Got to take my supplements. And I'm like, okay, how many supplements you taking? Oh, about 30 or 40. And then I'm saying to myself, well, when you take 30 to 40 supplements, it's going into your stomach, right? How do you breaking those supplements down? You better say stomach acid. And then I'm going to say, what if you don't have enough stomach acid? Well, then you're not breaking the supplements down and they're becoming toxins too. You have to remember that whatever you put in your mouth that's good, if it can't get out, becomes toxic. Right? So everybody's on the supply side. I'm like, dude, you got it the wrong way around. You got to get rid of the crap inside first. You got to get waste management side first. And the one way you help that is by decreasing tension in the body through your breathing and through your TMS work and your emotional work, because I can relax, and then blood flow and lymph flow can begin to go. But then you have to go more targeted at those particular areas. And that was the thing that I was looking for on my entire journey in healthcare, was why were people struggling to get well? Because they don't understand, even medicine doesn't understand this fundamental process mechanism. And when you hear what I'm telling you, you're going to yourself right now, know you're saying to yourself, holy crap, that makes a lot of sense. And I know it does, because that's the way it's supposed to work. Right? So that's why it's not so much the techniques that you use, it's the order in which you do things that matters on whether it's going to work or not. Okay. So what I mean by that is that I don't care what supplement I give you, it's not going to work as well if I don't get the back end working first with the waste removal side and the blood flow side. And that's what I concentrate mostly in my work. And a big way you can do that is just by decreasing the emotional intensity and sympathetic dominance that somebody has in their life. So then these systems can actually begin to function the way that they need to. You follow?
I do. Unfortunately, it's taken me years to get to the point where I know that was what years and many thousands of dollars and pounds of spending on supplements and doing diets. And yeah, just doing exactly what you're talking about and not taking care of the other side. I think when someone first told me about that and said, you need to focus on detox pathways and et cetera, et cetera. So I started to do, lymph massages, saunas, all that kind of stuff. But then I guess what's been really difficult for me, because I am very, sympathetic's the more masculine one, or is that right? Sympathetic?
Yeah, sympathetic's the fight or flight, don't die one.
So I'm definitely more dominant in that. And I've found it, I've tried a lot over the years, and I'm still doing stuff now. And I think it's just, for me, it's, it doesn't come as naturally to me. So like, I have to, keep at it and trying more things. What would you say to someone like that, who is, very sympathetic, dominant, and, I'm sure I'm saying this and you'll probably say, everyone says this, meditation's really hard, breath work I actually find is a better way of doing it for me, maybe because it's more active. But what's like the first step you would give to someone like that to try to calm things down for them?
That's a great question. Well, most people are sympathetic dominant because we're wired to be that way. I mean, it just happens because nothing in your body wants to die.
Yeah.
So it's always consciously and subconsciously doing whatever it can in the background to make sure that you don't die, right? Your happiness is a distant second in life. Not being dead is number one. You understand? And it'll do whatever it needs to do, whether it makes sense to you or not in the moment, to make that happen. And that's what I tell people. You have to remember that everything your body's doing right now is not because it's broken. It's actually really efficient. It's probably just really good at doing the option that it chose. And why does it keep doing it? And I'm going to tell you the reason, because it worked for it at one point. If something worked for your brain to make sure you didn't die, it's going to keep going to it all the time because you're not dead. You understand? Yeah. It may not be the most useful for you anymore. That's the same with the emotional trauma. Whatever you went through to survive, you needed to go through it and hold on to it as a protective mechanism. And it's really hard for your nervous system to let that go because it's what it needed at the time. It just needs to know there's another option. And it's hard to see another option when you're stuck in fight or flight. You're just running, right? Here's the thing about sympathetic dominance. The people who get that way are usually the go-getter type A, go, 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 that's just their personality. But they're also want to do too much on the therapeutic side. You're like, okay, I'm going to do everything. And tell me the steps I got to do. And I'm going to take all 50 of them. And if 50 works, I can take 100. You're like, no, because you're putting too much into a system that's already overloaded. And the more you're in sympathetic dominance, the less you can tolerate. You become more sensitive to any interventions, even therapeutic ones, because every therapy that you do to yourself is also a stressor. And people beat themselves up if they fall off track too. So what I tell people is that, one, you need to back off and only do 1 to 3 things at a time, because just because you do it doesn't mean that your body's getting any benefit from it. Right? That's a huge one that I see in my world. And I'm not saying that supplements are bad. I'm not saying medications are bad. You have to do them within reason, right? And you have to remember that the system has to deal with whatever you're putting into it, and your tolerance level drops. That's like, when you're really under stress and then somebody just says hi to you and you turn around and you bite their head off, or you scream at them, or you have rage. That's a system that can't tolerate input anymore. And it'll automatically do a couple things. If you have a system that's really under stress like that, and you put it under more stress, it's either going to push back really hard and entrench itself even more. So the harder you push it, the worse you get. Or it's just going to say, I'm done. I give up. I'm tapping out, and it goes into shutdown mode. And that's the opposite. And that's the final straw of survival, is say, I'm just going to be a slug. I'm just going to sit here and not move and not interact with the world, and hope that whatever is trying to kill me eventually leaves me, and then I can get back up. But you don't, you get stuck there. So you have 2 options in that world. You're always on the go switch, going 1,000 miles an hour around the track, and you don't know what a brake is. Or your engine explodes and you just stop. That's when you know that you've hit the end of the pendulum on both sides. And each one of those has a different recovery medium as well. But here's the thing, man. It's all about awareness, right? You can't change something until you become aware of it. What I mean by that is this. Everything is always changing in life. That's life. Most of it you don't see. Why? Because you're not paying attention to it, right? Like, I bet you right now there's probably birds singing somewhere and you don't hear them because you're not paying attention to it. It's the same thing with the body. When I ask somebody, when's the last time you felt your left ankle when it hurt? You understand? So how about you just try to pay attention to your left ankle, and then you're like, oh my God, like I feel it, but the left one feels different than the right. So you're having more awareness because you can't change it till you become aware of it. That's the first step towards recovery, is awareness that you can take back control, and centers you into that moment that you're in. And here's the thing too, man. I learned from a neuroscientist named Bo Lotto, who said the number one stressor for the human nervous system is uncertainty, not knowing, inability to predict, the unknown, right? Think about how stressful that is, because if you don't know what's coming next, you're going to freak, right? And look at the world over the last 2 years. That's all it's been about, is uncertainty, not knowing. And that's what your brain is for, man. Your brain is designed to take in information from the world, outside the world and inside the world, through your sensory input. What I see, what I hear, what I smell, what I feel, what I touch, even on the inside. And even those cells that are swimming in sewage give feedback as well. So that information goes into the brain, right? That's input. And it's going to use that information. Here's the really important part. It interprets the information. Basically, that means it tells itself a story based on that information. And guess what? it's going to tell itself the same story it used to tell it. Why? Because it's the story that worked for it in the past. And it costs a lot less metabolic energy to use an old story than to make a new one. And when you're really tired, your brain doesn't want to use a lot of energy. So it says, dude, that hurt last time. It's going to hurt again. Same thing. You just grooved a pattern, neuroplastic. So what does story mean? That's perception. That's what you tell yourself about the input. That's why pain for you would not be painful for me, because we tell ourselves different stories. Once you tell yourself the story, then you have the output. You know what the output is called? LIFE, your life, your habits, your behaviors, what you do or what you don't do. So we cycle back to that again. Everything in your life comes down to the story that you tell yourself about what's coming into your system. But here's the kicker, man. What's driving your habits and behaviors are the information that you're usually not aware of. That's the subconscious information coming into the body. So you have conscious awareness, right? Everybody knows about conscious awareness. And you have subconscious that comes on in. That's the stuff that your brain has to take in. It's information. It's data all the time that you're not paying attention to. Because if you had to pay attention to every bit of data coming into your brain, your head would explode in half a second. Because like, dude, I can't, this is too much, right? Like you're not paying attention to the pressure that you feel on your butt by sitting in that chair, right? Or the change in blood flow that's got to send to your feet, or all these things that are happening in the background, but it's dealing with it, right? So what I tell people is it's that subconscious that's driving your habits and your behaviors. And part of changing that is just the awareness that it's there, and then the awareness that you can. And so there's a saying in my world when I teach people, it's this: we go after the pain that you don't know about to help the pain that won't leave you alone. Because your brain can only feel one pain at a time. You may feel it can feel multiple, but it can't. It's a split second between the two, and it's always going to take a priority of what hurts more. And there's certain areas of your body that it's going to pay attention to pain more than other areas, because it's a higher priority based on your survival. And that's really important for you to understand. So that's also a hierarchy of where you want to look for problems in the body. So when people come in to see me, they already know about the pain, that the conscious part of it, because they freaking point to it. And they point and they say, my shoulder hurts. And then medicine just gives it a fancy Latin name to elevate itself up. And you feel like you don't know anything because they gave it a big, giant, fancy name. So first of all, forget the names. They don't mean anything. So they already know about the shoulder pain. I'm going to treat that. But what I'm going to go for, what I'm going to look for is that subconscious, the pain that's there that you don't know about. A lot of times it's that emotional pain you don't know about, because you're not ready to go there yet to look at emotion, because you haven't hit rock bottom enough. People don't look at emotion-based causes of pain until they've exhausted every avenue whatsoever, and it doesn't look as unicorn and frou-frou and wizardry and some crazy thing about emotions. Trust me, brother, you get sick enough, you're going to go down that road. Because in my world, everything has an emotional component to it. That's why you're a human being and you're not a rock or a lizard. I mean, you have that aspect. It's just a matter of how much, how deep, and when you're ready to venture into it. But I'm going to look for areas of your body where you have just as much pain as the painful part, but you don't know it hurts. And this is when people say to me, how do I know that it hurts? And that's a really good question. I'm going to give you the answer. I'm going to press on it and see if it hurts. I'm going to put my finger and push in there, and you're either going to say, that feels no problem at all, or you're going to say, holy crap, I had no idea how much that area hurt. And I'm going to say, yes, you did. You just didn't know it at a conscious level. The brain has always known that it's there, which means it's had to work around it a lot. So it's trying to take care of the pain so you don't have to deal with it. You understand? Pain is the last thing you feel, not the first. By the time you feel non-traumatic pain, which means that Perry punches you in the face, A equals B, now I know why my face hurts. But if you wake up today and your face hurts and it didn't hurt yesterday, that's a long process. And you have to look at why it manifested there and then why it chose that time to do it. And I'm going to tell you the same thing. It's always about the process that I just told you before of nutrients in, waste out. So I have to treat that no matter where I'm treating. Because here's the thing, the body can do whatever the hell it wants, and it doesn't have to make sense to you. The human body is under no obligation whatsoever to make sense to you. But knowing that, you have to think like the body thinks. Right? The body's always going to try to heal you. It's always going to try to protect you. It's always going to try to bring you back from illness. In order to do that, nutrients in, waste out. So I have to make sure that that pathway works. Because if it doesn't, you're going to struggle, man. You're going to struggle. Now, I'm not saying it's the only thing, because you need to check that box and make sure that that works. Then you stand a much better chance of getting the recovery that you're looking for. Because listen, sometimes stuff is just broken, man. You're only going to come back so far. I don't believe in the word cure, because cure implies you're never going to get it again. That's not life. I mean, you manage things. You manage to have it or not have it. You manage it's intense or it's not intense. That's the pendulum, right? So, and there's no cure for anything in my world. So you have to watch your language too, because that's really, really important. The words you use and the way you say your words changes your emotional state, which changes your physiology, which changes your TMS, which can make you sick or get you well.
I think some people, when they hear, oh, you can't be cured, I think they get that confused as in you can't feel well. But I think they're two very different things, right?
Yeah, cure has an implication to it. If I say cure to you, what does that mean? It's gone.
Yeah.
Well, for now, but it's not. It doesn't mean it can't come back whenever the hell it wants to.
Yeah.
So you have to look at the word manage, because that's what it is.
Yeah.
How do you manage it? Well, by your lifestyle, by the choices that you make, how you think, what you choose to eat, where you choose to live, the people that you choose to have in your life, how much of a victim you feel on something, right? So people think that might be semantics, but I'm like, you know what? When you're really, really sick, semantics means a lot.
But the word manage for me has quite a negative connotation to it, because I think people think when you say manage, it means you just make sure it basically can get worse, but it won't get better. And that's what I feel like. Whereas I think what you're saying, you mean manage is in how people just manage their health to keep them at an optimal level. And that's what you mean, right? You're not saying.
Yeah. So you don't have to use the word manage. I mean, if manage is a word that you feel for you has a negative connotation, then you don't use that one. But so let's say you're the perfect specimen of health, man. Like you're at top of your game. You got to manage that too.
Yeah.
Because if you don't manage it and you stop doing things, same thing, right? So you don't have to manage being sick. You got to manage being well too.
Yeah.
Right. And manage is self-responsibility, because when it comes to your health, nobody should care more about it than you.
Yeah.
And listen, you gotta chop the wood and carry the water, man, which means you got to put in the work to do it. So manage is the word that I use. Cure, I don't like that word at all. For me, some people might want to use that. That's great. But you have to remember that whatever you do in relationships to your daily behaviors, right? That's your habits and your behaviors. That's little and often over the long haul. So people want to just do one thing and then I'm all better. Or I want to do these things for a couple of days and then I'm all good. Health is a journey. It's not a destination, right? When I tell people this, is it's really important to reframe. Let's say that you're on A And A is whatever illness that you have or wherever you are in your life. And B is your cure, right? Like you don't have it anymore. The goal isn't to go from A straight to B, because you're probably not going to do a direct step from A goes right to B, right? And that's a lot of pressure on yourself, because you compare yourself to other people and you put yourself under some preconceived notion of a timeline, or you go into, God forbid, you go into support groups and then you fall into a quicksand and you're never going to get better because everybody wants to be more miserable than the next person. Your goal is not to go from A to B. Your goal is to go from A to not A. What does that mean? That means one thing: do something different, change something up. And this is when people say, what? And then my answer is yes. I don't care what it is. How about you pick one of the big things I told you in the beginning? Are you drinking? What's your nutrition like? Are you sleeping? Right? All those sorts of things, the hydrating, all those sorts of things that we talked about. And you don't have to do all freaking 4 of them, man. Just pick one. It's a not A. Because everybody is so stressed that they're going to make the wrong move. They don't make any move. So when you do what I call tiny little action steps, just do one little thing, move the yardstick just a little bit more and see what kind of changes that you get. Just do one thing, see how you feel after a couple of days, and add another thing in there and just stick with it.
Yeah.
Right? It took you a long time to get where you are in relationship to habits and behaviors and sickness. It's going to take you some time to get back there. Right.
With regards to, getting rid of waste, like getting that function going, and you said you need to know that that's working correctly. Like, how do you know when that process is working well and you're therefore in a position where you can focus more on the inputs?
Yeah, great question. So I'm always on. So how you know when it's not working well? Well,
you feel like shit.
Yeah, you feel like shit. You got a chronic disease, you got chronic pain, you got an illness, and whatever it is, because it's going to manifest itself however it wants based on your own genetic makeup and for you. Yeah. But it's still inflammation. Like your inflammation may manifest as fibromyalgia. My inflammation may manifest as rheumatoid arthritis. It's the same damn inflammation. It's just coming at you a different way, and it's got a different label to it. Right. But I'm still going after the fundamental premise of the waste management. And then you have to ask yourself, well, how does the body get rid of waste? Well, you sweat, right?
Yeah.
So sweating is a big one. And most people don't do enough sweating because they don't move and they don't exercise. Maybe because they're very sedentary, they're obese, or they're afraid to move. That's why infrared saunas can work really, really well, right? Get you to sweat. What about urination? Pee, right? So you pee things out, and you got to make sure for urination that you have enough adequate hydration so that you can urinate out. Then you poop, right? Mm-hmm. Pooping is called phase 3 detoxification. So and then I'm going to ask, are you constipated? If you're constipated, then you got a detox issue. Right? Do you have too much? Do you have diarrhea? That can be a detox issue. Then you always have to ask, in my world, how often are you going? Is that normal for you? What's the formation like? Is it soft? Is it hard? Does it stink? Does it, all these sorts of things that I have to ask. And I'm also going to smell you and see if you stink, see if your skin stinks, because that means that your skin's putting out more detox because it can't get out usually through your lymph or your pee or your poop. So it's got to go out somewhere. It's got to go out through the skin. And then the other big one is the lymphatics of the lymph system. So, because that's the primary one that gathers most of the bacteria, viruses, toxins, proteins, stuff that's too big to travel out through the bloodstream, travels out through the lymphatics, even cancer cells and parasites. So it traps them and it tries to break them down and kill them and then process it to all the other avenues as well once it's broken down and killed. But if it's overloaded and it can't do that, then it just stays and stagnates in the water around your cells. So that's what body aquarium means that you mentioned before. I always explain to people about the waste management systems of the body like a fish tank. So you got a tank full of water, right? Well, that's basically what the fluid in your body is like. And the fish are your cells. And you have to feed the fish, right? So you put food into the water and then the fish eat the food. And then what do? They crap. And then the crap goes where? In the water. So what do you need in order to keep that water looking really good so it doesn't get green, algae, fungus, murky, bacteria, and low oxygen? You need a filter, right? Yep. What's the filter system of your body? Lymph and blood flow. If that doesn't work well, I don't care what the hell you do to the fish tank. What you do to the fish, whatever food you give it, no matter how many times you change the water, no matter how many times you clean the tank, if you don't make sure that your filter system works well, everything in that tank is going to die. And if you ever see fish in a tank with low oxygen, they're always like this. They're struggling to get oxygen. And that's what your cells struggle to get. And when you have low oxygen, you can't make enough ATP, you can't make enough energy, you're tired, fatigued, lethargic, you can't make new cells that work. So I tell people, how would you fix the fish tank? Make sure the filter system works well. And that's exactly what I do in my world first, right? And then you go after everything else. And people always ask me, how do you know the lymphatic system is an issue? And I'm like, that's easy. You're alive on this earth and you're breathing. That's how I know it's an issue, because nobody ever talks about it. Nobody ever takes care of it on purpose. So they don't know what they don't know. So I know it's there. If you have a chronic disease and chronic pain, I already know it's an issue. In my world, you can't have that without the lymphatic system being involved in some way, shape, and form, sometime absolutely significantly. And the other big detoxification organ in your body is when you breathe. So every time you breathe, you exhale toxins, right? So carbon dioxide that you exhale out. And that's one of the biggest breathing apparatuses that you have. A lot of people have too much lymph congestion in the lungs. They got too much lymph congestion in the liver, too much lymph congestion in the gut. And the liver is a big part of your lymph system. The lungs are a big part of your lymph system. And most of the lymph is in your gut. And 70 to 80% of your immune system is in your gut. So people hear about gut health all the time, right? Got to take care of your gut, got leaky gut, malabsorption syndrome, gluten intolerance, stuff like that. And I'm like, okay, yeah, that's good. But that's inflammation, right? So when anything breaks through the gut lining, that's not supposed to break through the gut lining. I'm going to give you one guess, which is the first system there to take care of anything that breaks through it that's not supposed to be there. And you should be saying lymphatic right about now, right? So nature is not stupid. She knows that the gut is important and it's the biggest part of your immune system. So I better put the biggest part of keeping that healthy right there, the lymphatic system. So that's why in my world, we always work with that. And the lymphatic system is part of your vascular system. So your circulatory system and your vascular system are one. You cannot separate the two. So if I'm going to go back to TMS, tension myoneural syndrome, decreases blood flow. When you decrease blood flow, that's backflow into lymph flow. Then you get stagnated lymph flow, stagnated venous flow, stagnated ability to get rid of waste and get nutrients in. It's such a fundamental premise, it's mind-blowing that just check those couple of boxes off. So here's the thing. I know we're running out of time, but I'm going to tell you. When people come in to see me, I have this hierarchy. This is a step-by-step process that I go through, kind of like a checklist manifesto. I got to check these boxes off to see if they're an issue. I have 9 of them. I'm just going to go over the first 4 and the last one. Number 9 is where you point your finger, site of pain. So to me, it's the least important part that I'm going to take care of, especially when it's chronic, but I'm going to treat there. The first 4 places that I check off on everyone, the first 4 in this order. Number 1 is stress, emotional stress, physical stress. That's life. That's tension myoneural syndrome. That's sympathetic, parasympathetic system. If I've got to get you out of sympathetic fight or flight mode, your cells can either be in growth mode or defense mode. They cannot do both at the same time. That's number 1. So that's brain. So I decrease the stress response. Number 2, lymphatics. I clear the lymphatics. Number 3 is gut, right? When I clear lymphatics, I automatically help gut. When I help number 1 with the vagus nerve is the number 1 nerve for your parasympathetic nervous system, and it goes to your gut. So when I help your gut, I help number 1 at the top with the stress response, because most of the vagus nerve is sensory up from the gut and the organs to the brain. So I'm already working the top 3. And then number 4 is vascular. That's blood flow in and blood flow out. If I can check off those 4 boxes first when I see you, that's the alphabet. That's the fundamental list. That there's no way you're going to read Shakespeare if you don't know your ABCs, right? If those are good, then I move to other boxes. And my job is rather simple. I'm not the first person you see with an issue. I'm the last one. So I already know you've been through most everything in relationship to assessments, tests, looking to make sure that your back doesn't hurt because it's cancer. You know, they ruled all these things out and they're like, I don't know what to tell you, man. It's probably all in your head. Learn to live with it, right? Then you usually end up finding to see me. And if you walk through my door asking me for help, I already know you have the top 4 as a problem. That's why you're walking through my door. I just now for you to understand it and you to realize it. And part of the reason that people don't get better is because, like you said in the beginning, there's so much information that you don't know where to go. You don't know what to believe. It's one person says this, the next person says, no, don't do that, do this. And so what is that? That's overload of information, which is a form of what? Uncertainty. So you're back into the stress response again. So you get caught in this vicious quicksand that you just can't get out of, like a crab in a bucket. You just keep getting pulled in. So one of the best ways that you can get better is to have a roadmap of what I just told you, right? So you have a system and a checklist to follow. So those are huge in relationship to the recovery, because it's not just not knowing something that can stress you out. It's too many damn options. You follow?
I do. Yeah. I've got a few questions, if that's all right.
Sure.
Just going back to the waste removal. For myself, I've been through periods of time and more recently where I've been doing a lot of saunas. I've been doing enemas. I've been doing what else is there? Oh yeah, I drink a lot of water, so I'm going regularly. I've had lymphatic massages, but like I went through a period where I was doing like 1 a week in London for like 6 weeks, but it's so expensive I just had to stop it. Is that for lymphatic? Because I heard you can do like self massage and stuff like that, right? What do you do for lymphatic stuff that's not so expensive potentially?
Yeah, that's a great question. So listen, the first part of changing your lymphatics is knowing that you need to change it, right? Just people say, lymph what? Like, nobody ever talked to me about lymph when I was sick. Not once. And listen, I'm in healthcare and I didn't even think about it. So I can't fault people because I didn't look at it either. I only looked at it when I was at rock bottom and nothing was helping. And when I found it, I'm like, that's the answer for everything I've been looking for. So there's many different types of lymphatic techniques and they all work. And they're just done a little bit differently in relationship to techniques. Some are really, really super light. Some are isolated. Some are more full body. Some are a little bit more aggressive in relationship to depth and pressure, which is like mine. Mine is not your typical lymphatic technique. Mine has more pressure and depth to it. But yeah, I always tell everybody, you can treat your own lymphatic system, right? It's not rocket surgery. It's not difficult to do. People will make you think it is because they want to keep it to themselves and have you come see them. But as long as you know how fluids flow in the body, like where it's trying to go, like a stream, like water coming off a mountain trying to go down to the sea, as long as you know the pathway, you can work with it. and you can do self-treatment techniques. That's what I teach people all the time. I wanted to empower people to be able to, first of all, know about the lymphatic system, and then 2, not be intimidated by the lymphatic system, and 3, start to work on the areas of the lymph yourself. Many, many different ways. There's no magical, perfect unicorn way to move the skin or push anything in a direction, but there is an order that you have to do it in order to get the best results or any results. And that's just based on how fluids flow. It's called hydrodynamics. And it means one thing: high pressure on fluid always moves to low pressure on fluid. Like water behind a dam. There's a lot of water on one side, so that's high pressure. And it's always wanting to go to where? Yeah. The low side, right? So once you know that, you automatically know where everything wants to flow. The problem is, can it flow? Can it get there? Or is it blocked? Is it stagnated, or what I call choke points? Is there an actual dam there that's preventing it from coming through or slowing it down? So is there a big pipe that's so congested, like stuff in a sewer, that instead of being 4 inches long, it's only 2? So stuff goes through, but not enough. And then it backs up and it backflows. Right. So I'll be happy to teach you and show you, and your listeners can follow or hear what I call the Big 6. And the Big 6 is where you massage, rub, or stimulate these 6 points in order 1 through 6 all the time. And that'll start to significantly open up the biggest areas of your body where lymph gets choked off. Prefacing it to say this: the longer you've been sick, the longer you've had an issue, the longer you've struggled with detoxification, the slower you have to go. Because when you've been sick for a long time, you can't tolerate a lot of work. And those who struggle with detox, lymphatics is going to start to move things. So you're going to detox. But you have a system that might not be able to handle a lot of it. But if you do the Big 6 and you do it lightly and the way that I'm going to show you, you should be okay with it. And I tell people you can do this every single day if you want to. You can do it more than once a day, only if you don't have a detox. If you have a detoxification, then I tell people do not do the Big 6 again until you start to feel a little bit better from your detox. Now, people say, what's a detox? It's exactly like it sounds. You feel like crap. You feel worse, tired, fatigued, lethargic. You have a headache. You feel like you're sweating. You have more pain. You feel like you just are sick. That's normal. It's to be expected, but you have to have your body a chance to recover from that, because you don't want to throw more at a system that's already trying to recover. It's just not going to give you any benefit. Does that make sense?
Yeah. If you're able to show us that would be amazing.
As long as it's okay on your, dude, I teach like 16-hour classes. I can just nonstop go.
Oh, how long? Is it going to be a 16-hour?
No, it won't be that long. Yeah. It's really, really fast.
Cool.
So for those that can see, they can follow along. For those that are listening, I'll tell you where it is. So let me go first where the lowest pressure that fluids drain in the body for lymph and for veins. Why is that important? Because those are the 2 primary conduits of waste removal. It's at the collarbone, above and below the collarbone. That's the lowest pressure. That means everything the furthest away from that, your fingers and your feet and the top of your head and everything in between, wants to go to the collarbone. That makes sense. That's why when people have a lymph problem, they get swelling mostly in the feet and the legs, because it's the furthest away from the neck. That's the highest pressure, right? But in order to go from the feet and to go from the fingers, it has to go to the neck. In order to get there, it's got to go past the knee, past the hip, past the abdomen, past the elbow, and into the shoulder and into the neck. So if there's any blockages along there, it can't get there. So whenever we work lymphatics in my program, we always go collarbone up to the top of the head, collarbone down to the feet, because that's working low pressure to high pressure. You don't ever start in the feet. You don't ever start in the fingers. You don't ever start at the top of the head. You start at the collarbone and you work your way out. Got it? Mm-hmm. Spot number 1 is above and below the collarbone on both sides. So this is a really simple technique that I learned studying Qigong and Eastern medicine. It's rubbing and tapping, which is a form of massage stimulation to the tissue. So we're going to do the left side first, because the left side is where most of the lymphatics drain, to the left side of the neck. You take a flat hand, place it over your collarbone. So you have fingers above and the palm below. Keep your hand flat. I want you to rub above and below the collarbone in any direction. It can be up and down. You can even do circles. Circles work really, really well. I just want you to do 10 rubs, right? And then your pressure can be light. It can be a little bit harder. Just depends on what you're comfortable with. And then after 10 of those, you're going to take your whole hand and you're going to lightly tap and slap on, above, and below the collarbone with the whole hand. And don't hit so hard that you hurt yourself, but don't go so light that you don't feel anything. Then you're going to go to the right side. So use your left hand and do 10 on the right collarbone, above and below. Speed doesn't matter. If you like slow, go slow. If you like fast, go fast. Don't overthink it. And then tap 10 times. Okay, that's spot 1. You always start there. Mm-hmm. Number 2, you're going to go to the top of the neck. Right at the top of the neck, you're going to go behind the angle of the jaw, right by the lobe of the ear, and there's a space that sits right there. Yeah. So you're right behind the angle of the jaw and below the earlobe, right there. Okay. Mm-hmm. So that's the largest lymph node in the neck. You have a left one and a right one. So I want you to take your fingers. It can be left hand or right hand, whatever's more comfortable. I want you to rub right there at the top of the neck, on the side, right behind the angle of the jaw and below the lobe of the ear, 10 times. Right. Now this one, tapping you can do as long as you don't feel like it hurts, because you're close to the head. Just take your fingers and lightly tap right at the top of the neck behind the angle of the jaw 10 times.
If you're not getting it exactly on the spot that you're saying, but it's near, because like,
as long as you're near there, you're going to get it to move.
Okay, cool. Right? Yeah.
Because when you do that, you're tugging fascia and it's going to move it. Right? Yeah. Then you do the right side, right at the top of the neck, right behind the angle of the jaw. Right, 10 times, and then lightly tap. Okay. That's 2. Number 3 is going to be at the shoulder joint as it attaches to your pectoral muscle. So right here, right at the shoulder coming into the pec. Mm-hmm. So I want you to take your hand and rub all along the front of the pec and into the shoulder, right by the armpit there. Okay, circles work really well. And then use your whole hand over that front shoulder pec region. So you're not on your shoulder and you're not just on the pec. You're right in as both of them connect. Do 10 times and then do the same on the other side. You're getting what they call the pectoral and axillary lymph nodes. Now, lymph nodes are the mini toilets, slap, like you have in your house. So those are where things get stuck. Okay. Number 4 is on the abdomen. So I want you to place one hand flat on your belly button and then one hand flat above that. So both hands are on the belly. And all I want you to do is either rub up and down or go in circles, right? You can go clockwise, you can go counterclockwise, you can go up and down, you can go side to side, right? And then I want you to take your hands and I want you to hit your belly 10 times with both hands. Okay. That one is step what? We did 1, we did 2, we did 3. That's step number 4. We got 2 more left. Mm-hmm. This one's going to be along the crease of the groin. Like when you're sitting and you have that crease along the groin there, mm-hmm. Those are called your inguinal lymph nodes. So I want you to take your hands and put them right on the crease of the groin, and you can go across, above and below, or in line with it, right? In line with it. You can do it standing or you can do it seated. Normally, I would like it standing because when you sit, you trap them off. And then I want you to slap the crease of the groin 10 times on both sides, being careful not to hit yourself where it's going to hurt in your privates. You'll only do that one once.
Yeah.
And then that's 5. And number 6 are the nodes behind the crease of the knee. So you can do it seated or you can do it standing. I want you to rub behind the crease of your knees, up and down or circles 10 times. And then I want you to slap the back of your knees 10 times. And in Eastern medicine, they call that the magic back point because that helps alleviate lower back pain. Right? Now, when you did all that, now you can get the body moving a little bit. If you can, and you're at home and you want to do it, I teach people what's called self-rebounding, where you just stand up and then you lightly jump up and down on the balls of your feet with your heels leaving the ground, kind of like a little pogo stick, a little piston. Yeah, I would encourage you not to jump completely off the ground if you're new to this, because many people don't know how to control impact and they'll hurt the ankle, they'll hurt the knee, they'll hurt the hip and the lower back. So just kind of stay on the balls of your feet and go up and down with your heels, shake off your hands, breathe in and out through your nose, not your mouth, to move your diaphragm muscle more to help pump the lymph. Now, why is that so important? Because 2 things move the lymphatic system fluid primarily. One is movement. Moving more of yourself, more often, more ways, more environments moves lymph. That's why exercise is good. That's why walking is a lymphatic powerhouse. The other one is breathing, right? Breathing through the diaphragm, through your nose. So that increases pressure in the abdomen, which moves the lymphatics, right? But nature is really smart, like I said before. You've got about 600 to 700 lymph nodes. Those are the mini toilets, and they gather in clusters together. And since we know that movement moves lymph, nature put the big clusters around the primary joints of your body that need to move the most, like your upper neck, your shoulder, your abdomen, your hip, and your knee. And those are all the ones that get locked down when you sit all damn day. So that's why when you stimulate those out in that order. And here's the thing. People always go to me, they say, that's it? Like, that's all? It can't be that simple. There's no way it can be that. First of all, I'm going to say, who the hell told you that? It certainly can be simple. Effective things don't have to be complicated. And then you wait and see. Like when you do that, that's no joke, because when you slapped all those regions, guess what else you just freed up? Blood flow, right? Arteries out, veins in, where the big pipes sit that become smaller pipes, and you have clusters of these things called nerves there. So you helped everything, right? That is a fundamental self-help, easy thing you can do on a daily basis. And then here's the thing. What I tell people is do those big 6, then you move, then you walk, then you breathe, then you run, then you do your workout, right? Because you want to free up the points. Then what? Then increase the flow, right? Because if those places were choked off and you just started moving, that movement is no longer enough to clear the choke points. They have to be cleared first. You understand? So in my world, I always say this: lymph always, always, always comes first. Then you do everything else after that.
And when you're doing the self-rebounding, you said the balls of your feet don't leave the floor?
I would not encourage that in the beginning to people that are just starting, because first of all, most humans don't jump up and down. Right. Yeah. And you don't have to buy a rebounder. You can, but your calves are actually built-in rebounders. And your calves are, this primary job is to pump blood back to the heart. It's called the second heart. in Eastern medicine. So it pumps that fluid flow up. But yeah, so let's say you're standing and your heel is flat and the ball of your feet is on the ground. You know how you do like a calf raise where you just I just want you to do that, like lightly rebounding a little bit. So the heel comes up, but the ball of the foot stays there. And just do that for about 30 seconds to a minute as you shake off your hands, and you can then start to move a little bit like a fighter in a ring if you want to. And then the more comfortable that you get, then you can take your feet completely off the ground, as long as you don't feel like you have pain in your knees, your hips, or your ankles. But I've been doing this a long time, and most humans have very poor mobility in the big toe. They have very poor movement in the ankle, and then they're starting to jump up and down, and they don't have the impact mechanism to slow down movement. It's called deceleration. And then they transfer that force somewhere else, and then they get hurt. Okay. So you just start off easy, and then you can work your way up. And then you can walk, right? Because walking is basically like rebounding in a way, especially when you make it a more brisk walk for yourself. And then walk different directions, walk backwards, walk sideways, walk in circles, walk a zigzag. I would tell people, do a DNA pattern on the ground, like, just spiral, circles, all sorts of different things, even walk the damn alphabet. I just want you to do something different than what you normally do to stimulate the lymph and stimulate the body. But here's what I'm going to tell you. If you walked and then did the big six, it's not the same as doing the big six and then walking. It's a totally different experience. Like, just shifting that order around is no joke, man. That's huge. That's like following a recipe. Like, you got to put this ingredient before that ingredient, because if you don't, your cake is going to really suck. It's the same thing in relationship to the order that you do the stuff that I'm showing you in. That's paramount. The only thing that I tell people is non-negotiable is the order. Yeah. What you do to those 6 places, I'm going to be honest with you, I don't freaking care. Like, you can rub it, you can tap it, you can use a suction cup, you can use, a little massager in there, you can thump it. I don't care what you do. I just want you to know that that's the order that you do it in. You never do 6 to 1. Yeah. Yeah. You always go 1 to 6. Otherwise, you're going to be in a world of hurt.
So just to summarize then, and thank you so much for doing that, as people will get so much from that. I have, so I'm going to be doing this from tomorrow. If someone is, as a beginning point, if someone is doing the big 6, they're doing the walking, they're doing the self-rebounding, they're doing that with some sauna, maybe 3-4 times a week, I don't know. They're also doing maybe some enemas as well. Would you say that all of that together is enough to get things going and to take care of that waste?
Well, it can be, but you got to remember also is that you can't overload the system. Okay. Do too much. If you overload the system, your progress is going to be worse. Right. So I just showed you the first step in lymphatics, which is the big 6. Yeah. But dude, there's way more to it than that, because we go even to the deeper lymphatics, which is around the organs. So there's a system that I teach people from beginner part, which is that one. That's the ABC one, all the way to the more intensive. And the longer you've been sick, the more you're going to have to go through to go to the intensive. And you're going to have to go slower to get there, though. Okay. If you rush in too much, you'll actually slow your progress down. I know I've said that a lot, but that's really important for people to understand.
Yeah. Okay. So people listening to this, you mentioned a program. Is it a course that you have online? I know people can work with you individually, but is there a course that people can learn with online? Like how does it work?
Yeah, I've got a couple of options. So always available all the time is a self-help video that you can purchase and then stream it for life. Once you get it, you own it for life. And it's a Lymphatic Mojo body aquarium video that's about 2 hours long, a little bit more. And then we go through the techniques that I showed you there and the whole assessment of the lymphatics and then explaining them. And anybody can get that one. And then we have a more intensive one if you want to continue your journey, which you likely will if you're really sick. Then you go to our 2-day intensive course that's called Lymphatic Mojo Body Aquarium as well. But that's much more content, much more structured in relationship to how to go about it, depending on what your issue is. And that's a 2-day course that's delivered online right now until I get back to in-person teaching, which I don't know when that's going to be. But that is 2 days, about 16 hours worth of content that you can tune in live if you want to. But if you can't tune in live, but if you register, you get the full recording afterwards with access for life. So you can watch it anytime, always and forever as well. And then you can certainly work with me directly through consultations. I have in-person clients that I see, only about 6 appointments a week. And then I do online as well through video consultation. So there's different ways that you can put your foot in the water in relationship to lymphatics. But the most important thing I think from our conversation today is for people to just be aware of that system, how important it is, and that you can begin to take care of it yourself and become empowered to take back control of your life from pain and chronic disease and all these sort of things. And the lymphatics is a fundamental box to check off, as well as the sympathetic nervous system. But here's the cool thing, man. Remember what I said before about all the systems of the body work together? When you do the lymphatic work that I showed you, you're also going to do stimulation to the sympathetic, parasympathetic system, and you're going to help the vagus nerve. So you're automatically going to decrease stress when you do the lymphatic program, because all these systems run together. The big spots that I showed you in the neck are the 2 primary places that you want to go to stimulate your vagus nerve anyway.
Yeah.
And you just did it.
Yeah.
That's a double win. All right.
Awesome. Cool. Look, thank you so much. I think people, listening, will at least got that for free today. So I think they'll be really happy that they can use that and kind of move on with that. We'll include, any of the details of your program and whatnot in the show notes. But yeah, thank you so much for sparing the time. We've gone way over what I told you it would be, but for me, it's been amazing. So thank you so much for sparing the time.
Thank you so much, my friend. We hit what they call the flow state, which means that it went by just like that. I had a blast. Thank you, everyone, for listening.